So good morning, my name is Andreas Moutsoudis and I'm a plastic surgeon coming from Thessaloniki, Greece. So it's a great pleasure, and I would like to thank Hironic Global and Pan-Timeless from Greece for giving me the chance to put up a nice talk about RF microneedling. As I'm a key opinion leader of Hironic, I run my own private clinic, and I'm also at the university working a lot with cancer patients in Thessaloniki. And I would like to say a few words before presenting a short video from my private clinic. So what is RF and why is it combined with microneedling? It's a very smart and delicate needle system that generates a thermal effect through the advanced RF technology, emitting heat through the dermal layer in between 0.5 to 3.5 millimeters. And this way it causes collagen type 3 production and re-epithelialization. Now, this is very important because epidermis and dermis are targeted from sun, smoke, heat and other factors, and the skin changes a lot through the years. In our clinic, we have so far treated all kinds of reconstructive and aesthetic conditions in the last 18 months, and we are about to run two very interesting protocols in the next 1.5 years. Few examples that I'm going to show you a bit later on are from pustular acne scars, stretch marks, melasma and post-inflammatory skin discoloration conditions, plus burns. Healing is generally separated into three big phases. The first one is the inflammatory phase, the second is the remodeling phase, and the third one is the proliferative phase. RF microneedling is nowadays a gold standard therapy for anti-aging and skin rejuvenation. Gentler protocols are successfully very well combined nowadays with different kind of pills, mesotherapies, fillers, exosomes, as well as triamcinolone steroid injections into keloid and hypertrophic scars. Gentlo is used in my practice prior to eyelid surgery, facelift surgery, and post-surgery as well, abdominoplasties and breast reduction in order to improve the skin tone and the skin elasticity. RF helps to provide excellent results with microneedling, with stretch marks, diminish the large skin pores, improve periorbital and periolar heritage, improve the dark circles, combined with fillers, and as a conclusion, improve the skin tone and the elasticity, giving a lift-like effect. All Fitzpatrick skin types are applicable to Gentlo protocols. Our selection of patients is always very careful, and a very detailed medical history is taken prior to all kinds of therapies. Obviously, autoimmune patients, cancer patients, diabetes, and other medical conditions are obviously excluded from our cases and our daily practice. So, I would like to emphasize on the following critical points concerning RF microneedling. First, Gentlo, as we use it nowadays, RF microneedling, is a great antibacterial type of treatment that minimizes the use of drugs. RF microneedling has minimal side effects with minimal downtime recovery time, which is very, very important. Imagine we live in a very sunny place, Greece, 365 days it's sunny. We don't have any problems using RF microneedling compared to CO2 fractional. CO2 causes a lot of damage, needs more than a week or 10 days if you do it the right way. If you don't do it the right way and you cause for 1 or 2 days some mild erythema, it's no problem at all. RF is only for 2 or 3 hours. Next day you're more than fine to use your SPF and go out in the sun. Gentlo, as I said before, is a gold standard for active acne, anti-aging and scar treatment, post-surgery, post-trauma, post-burns, post-acne. RF microneedling is amazingly combined with all kinds of pills, mesotherapies, exosomes, and all kinds of medical devices as well. Like we use it with dermabrasion always prior to RF microneedling in order to clean the basic epithelium. Finally, I would like to present a small video that we recently made to my clinical practice with no sound, obviously. I will just let you know that this patient is 45 years old of age. She's a female Caucasian. We treat her for stretch marks. I will afterwards show you as well the results. I have my assistants always helping me out, and actually they do a lot of the cases with my supervising. And the reason why we wanted to show you this small video is to present and see how the needles are so effective into the skin, and obviously how they treat. The patient has no pain at all, erythema is minimal, and she's happy to go afterwards with no complications at all. So obviously we have to make the right arrangements to gently and then treat exactly where the stretch marks are and see exactly the way that everything is being treated. No need to put any anesthetic cream before gently. I never use anesthetic cream, and we normally use some mild cream afterwards, not cold, obviously, to help the skin. So, we have 10 very interesting cases to present out of the many. First one is a 26 years old of age, female Caucasian. She has active acne. She had combination with dermabrasions, and this is the result after 4 treatments. You see how the pores have diminished, and she has great results. Second case, 43 years old of age. She had melasma and also acne scars. This has been in her skin for many, many years. It's not easy to treat that case, obviously. She also had CO2 fractional in the past. She had tretinoin in the past. She had too many medical devices on her face. Now, this is after 5 gentle treatments. And we are really happy for her to get these results. 40 years of age, more than 25 years of acne scars, cystic acne scars. She had isotretinoin therapy in the past, and we gave her 5 treatments. Prior to it, we always do microdermabrasion, and this is post 5 gentle treatments. Now, excuse me for before and after. This is a 40 years old, again with cystic acne scars, and she also had isotretinoin. I always mention that many patients have treatment with drugs, which is normal because a lot of clinical doctors nowadays, or years before, they used to administrate vibramycin or isotretinoin. But nowadays, we can use that very well. So this is before and this is after. 20 years of age, pustular acne, no medication given at all, nothing. Just microdermabrasion with diamond and phototherapy with blue light. And this is the result after 4 treatments. Now, this is the most interesting case we have done in our clinic. This is 1st and 2nd degree burn, chemical burn from sulfuric acid. This is a patient of mine who called me. She lives in an island close to Thessaloniki. She called me that she bought sulfuric acid in order to clean her toilet. She put the sulfuric acid in the toilet and this exploded back to her lower legs. Okay? For many people, these kind of images are not easy to explain, and obviously to the patient, herself how to treat her for many, many years. She had no surgery at all, nothing. What we did is we did loads of change of dressings for almost 2.5, 3 months. This means that twice a week she was at my clinic to change her dressings and clean her under some sedation in order to be more comfortable. Now, every 25 days she was coming and she was getting treatment. Combination with Kenalog, which is triamcinolone, to her hypertrophic scars. We started like that. We ended up like that. Even the hypertrophy on her lower leg in the combination of microneedling and triamcinolone is amazing. She is a marathon runner and she started running back again. And this is no surgery. I'm a plastic surgeon and we tend to operate a lot. We tend to put grafts and to do loads of different things. But this case was completely treated with Gentlo, nothing else. Another case of post-acne scars with inflammatory skin hyperpigmentation, 19 years of age, and we did 4 treatments with Gentlo, and these are the results. The lady that we presented on our video, she's 45 years of age, and she had stretch marks since age 15, so 30 years. 2 treatments, because this was the 3rd treatment on the video. 2 treatments post, these are the results. 26 years old of age, acne scar, who had isotretinoin in the past, only 2 Gentlo treatments, a week interval in between them, because she lives abroad. So we did quite aggressive treatment with Gentlo. And this is the result. Finally, a 32 years old of age with pustular active acne. She had diamond dermabrasion prior to the 3 plasma treatments and the 5 Gentlo therapies, RF Microneedling, because we always combine plasma and Gentlo. And this is her excellent results. So why to choose RF Microneedling? It's a very automatic technique. It has extreme fast recovery. It delivers collagen stimulation, promotes reepithelialization, and has amazing reconstructive and aesthetic results. Thank you so much, and we would be glad to answer to your questions.